Hello, my name is Emily. I'm here to apply for the nursing position on the general med surg floor.
Okay, it's very nice to meet you. My name is
too.
Catherine. I'm the nurse recruiter, and we're just gonna go ahead and get started, okay?
Okay.
So if you were in the break room and a fire broke out while all other staff was in a code, what would you do first?
Tough question. Let's see. If there were no other staff available, I know that you should rescue patients first. But if I happen to pass an alarm on the way to my patient's room, I would go ahead and pull the fire alarm to alert the other staff to the fire. And then I would start to rescue patients and moving them to a safe place.
Okay, good plan. Can you describe some of your strengths and weaknesses?
Some of my strengths, I work very well in stressful situations, and I feel like I work pretty well in teams, and let's see.
Some weaknesses?
Yeah. Some weaknesses, I can be a little bit shy with, other nurses on the floor for like the first maybe week or so, but after getting to know them a little bit, and being more comfortable, then I tend to warm up a little and not be so shy.
And a lot of people are like that. What are your short-term and long-term career goals?
Short term is to kind of really pull everything that I learned together in nursing school, just pulling it together, and that's why I want to start off on a med surg floor to kind of get those organizational skills and just have everything together, learn more about pharmacology and medications, and then eventually I want to go to the emergency room floor because, again, I like the stressful situations, fast-paced environment, and then long term, I want to be a school nurse.
Okay. How does this position meet those goals?
It meets the goals because, again, I want to start off on a med surg floor, and this is general med surg floor, so I feel like I'll be able to get a lot of experience. It's not just specific to one thing, and I feel like it will really help me grow as a nurse.
Okay. Can you tell me what frustrates you the most?
What frustrates me the most is when other healthcare providers aren't willing to collaborate and they just kind of want to go in, do their own thing, and get out. Because I feel like interprofessional collaboration is very important. You have to be able to communicate what's going on so that there's no miscommunication and the patient is provided the best care.
Okay. So one more question. Can you tell me about an important goal you set for yourself and how you were successful in achieving it?
An important goal for me was getting through nursing school. Growing up, I didn't really know what I wanted to do, and I knew it was something in the healthcare field. But once I picked nursing, I stuck with it, and there were definitely some challenges along the road. But getting through nursing school, I took advantage of tutoring options, extra hours after class, and I love that I went to a small university, so I was able to have that one-on-one connection with professors, and they really helped me. So I think just not giving up and always having a plan really helped me to achieve that goal.
Mm-hmm. Okay, Emily. Well, thank you so much for coming in. It was very nice meeting you.
Thank you. I had a few questions for you.
Oh, okay. Thank you.
I was wondering what your starting salary is for the med surg floor.
Well, it varies, but everyone normally starts on $24.50.
Okay. And then could you tell me a little bit about how shifts work? Like how many patients per nurse does a nurse usually have, and what are the hours typically like?
Mm-hmm. So on this floor, we normally do 12-hour shifts, and we do try to keep a fair acuity, but sometimes it varies. We do try to float nurses in when we're not meeting those expectations.
Okay. And then what is the possibility that I would be floated out to another unit?
It's not likely, but sometimes it does happen where a sister unit probably needs help and we do float. Okay. But we orientate on that unit before we do that.
Okay, awesome. Thank you so much, and I look forward to hearing back from you.
I will call you soon.
Thank you.